Hello guys, I hope you are. So today we're going through some Gphc exam revision, and the first thing I wanted to briefly go over is ramipril. So ramipril, as we've discussed before, or ACE inhibitors generally, should not be given for pregnancy or breastfeeding. However, an interesting fact is enalapril can be given for a breastfeeding woman. So this is a very crucial point to talk about. So ACE inhibitors generally are teratogenic, and any drug for that fact that interacts in the renin-angiotensin-aldosterone system cannot be given in pregnancy or breastfeeding generally. Now, as we are talking about, this would be an exception. So enalapril is suitable for breastfeeding, and that's very crucial. Now, when it comes to sort of contraindications and cautions, so ACE inhibitors are not recommended as there is limited information on their safety when it comes to ACE inhibitors with breastfeeding women, and ACE inhibitors should be used with caution in those that have renal impairment. Now why? Because people that are renally impaired are more likely to experience hyperkalemia, and that's very important. So be cautious of renal impairment with ACE inhibitors. So that's a very crucial point to understand. Now, if we quickly look at diabetes as well, so ACE inhibitors should be used with caution in those that have diabetes, increased risk of hyperkalemia, as it may lower blood glucose. Now, when we sort of look at drugs that can affect warfarin INR, what comes to mind? Now, generally, remember, any CYP inducer will decrease INR. So CYP inducers decrease INR of warfarin. CYP inhibitors would increase INR. Keep that in mind. Obviously, if CYP inducers decrease INR, then CYP inhibitors will increase INR. Right? That makes a lot of sense. Now, when we look at inhibitors, right, what are some examples of inhibitors? Inhibitors are like valproate, cimetidine, etc. Now, when we look at simvastatin, so the limitation of simvastatin to be given with amlodipine or diltiazem is 20 milligrams. You shouldn't give more than 20 milligrams of simvastatin with amlodipine or diltiazem, as it may cause myalgia. So keep that in mind when you're studying. And let me keep the video short. Thank you so much.